Hello, my name is Carolyn Haunschild, and I am a gynecologic oncology surgeon at UCLA. This means I did extended training to specialize in the treatment of cancers of the female reproductive system. And today, I will be talking about endometrial cancer. Endometrial cancer is cancer of the innermost lining of the uterus. It is the most common gynecologic cancer in the United States, with about 66,000 new cases per year, and the fourth most common cancer in women overall. In fact, the incidence, or number of new cases of endometrial cancer, is increasing each year. This may be due to increased exposure to hormones, like estrogen. Increased estrogen can be due to external factors, like hormone replacement therapy, or internal factors, like obesity. If you take estrogen hormone replacement therapy and you have a uterus, you need to take additional hormones called progestins to keep the endometrial lining from overgrowing and turning into cancer. Sometimes endometrial cancer is caused by genetic mutations that were inherited from your parents. If we suspect you have one of these mutations, it is important that we refer you to a genetic counselor to get tested. That way, you can understand your risk for other cancers and get appropriately screened. A common symptom of endometrial cancer is irregular vaginal bleeding. If you have abnormal vaginal bleeding, especially after you've gone through menopause, you should make an appointment with your gynecologist to get evaluated for endometrial cancer. This evaluation often involves an ultrasound and an endometrial biopsy. There are different types of endometrial cancer. Some types of cancer are low grade, and these are slow growing. Other types are high grade, and these cancers are more likely to spread to other parts of the body. The higher the grade, the more aggressive that cancer. One of the first steps of treatment for endometrial cancer is surgery, which also helps determine the stage of the cancer. The stage of the cancer is how far the cancer has spread to other organs in your body. Thankfully, most endometrial cancer is caught at a very early stage. Surgery includes removing the uterus, the cervix, both fallopian tubes, and both ovaries. We also perform a sentinel lymph node dissection, which is where we inject dye into the cervix that travels to the lymph nodes, and we remove only the first lymph node for testing. Sentinel lymph node dissection, compared to a full lymphadenectomy, decreases the risk of adverse events such as swelling of the legs. Frequently, this surgery can be done minimally invasively, meaning with small incisions, and our patients can go home from surgery the same day. Most patients who undergo surgery will be cured of their cancer. For patients with a high risk of recurrence, additional therapies might be needed after surgery. For women who want to try to get pregnant, or who are not able to undergo a hysterectomy, we can offer treatment with hormones. Sometimes patients are at an advanced stage at the time of diagnosis and cannot undergo surgery. For these patients, we recommend treatment with chemotherapy. For recurrent endometrial cancer, we can offer targeted therapies, such as immunotherapy, which are innovative new ways to fight cancer based on the mutations the cancer may have. Here at UCLA, we strive to offer our patients the best care possible. We collaborate very closely with other cancer specialists, including radiation oncologists and medical oncologists, and meet every week to discuss patient treatment plans and care recommendations. We also have a growing list of clinical trials to offer patients so that they can get access to the most innovative new treatments. Thank you very much for listening, and I hope to have the opportunity to care for you at UCLA.